So one of our, so this year we gave out 3 awards, I think, for the new entrants into our ecosystem. I don't know if you noticed, but this is part of Health 2.0 New York, which is like 6,000 folks like you interested in innovations in New York, and about 50,000 around the world. And so we look for people who really get engaged, new people who come into the space, and Grace is one of those people. She's been on a couple of our panels this year, and she's been actively engaged in a lot of the stuff that we've been doing. Of course, she's online a lot. She's always on Healthcare Leader and all sorts of stuff. She's not wearing her pink socks today because they don't go with her.
They didn't go with the shoes.
Yeah.
But I have a pin. I have a pin.
She's got the pin. So we're not Lyft drivers, although maybe some of us are. But we're healthcare innovation folks, and I don't know if you guys saw these jackets. Regina Holiday is one of our leaders, and just like Seth Godin says, you have tribes of people that really are into what you're doing, and people that help and collaborate. So the pink socks is one of those tribes. So if we're offering you guys pink socks, so it's Colin or me, that means we're welcoming you to this group. So the reason I mention this is because we welcome Grace to our group as our Patient Advocate of the Year in New York. So thank you. She got the T-shirt that goes with it too. She's not wearing that because it's really not that cool a shirt, but it was done by Regina. So anyway, and she's going to talk to us today about I can't even remember those names. You expect me to remember what you guys? Being patient-centered. I thought it was not just a buzzword. There's something about a buzzword in there, which is good. Okay, so I will get off the stage and leave room for Grace.
Great. Thank you so much, Alex. So I know I'm standing between you and lunch, so I'm going to keep it short, sweet, to the point. So being patient-centered and patient-centricity is all the rage. Many people in the healthcare landscape are dedicating to putting their efforts to put the patient first. As someone who's been a patient advocate and a care partner for over 20 years, I feel very hopeful in this change. But what does this mean? And we have to be careful and define what patient centricity means. Otherwise, it could fall into being a trend or another buzzword. I want to take a minute and focus on the word patient. Okay. It's a general word. It seems to be a catch-all phrase. But I'm going to ask you to look at it from a different perspective for clarity. Okay. Please consider using person or human with a diagnosis. People say we're all patients. We're all going to be patients. And that couldn't be farther from the truth. There's a distinct difference between the patient that breaks their arm and goes to the emergency room and the patient that has advanced cancer who is told that their illness is no longer responding to treatment.
So when we do
There's a distinct difference between the patient that has strep throat and goes to urgent care versus the patient that struggles with a rare, undiagnosed disease on a day-to-day basis.
We give them some space.
We also hear the word that patients are consumers, and a little bit of me dies when I hear that.
Investment banking stuff.
You see, consumers have access to information, cost transparency, multiple choices, customization, ability to expedite. The transactions are done mobily, at the touch of a fingertip, and generally in a pleasant manner or matter-of-fact manner. And another differentiator is there's no sales in healthcare. Correct me if I'm wrong, I have not seen a Black Friday sale saying buy one MRI, get one free. So if I had to put a stake in the ground, I would say patients are not consumers. When I'm approached by a company for my expertise, perhaps they have a platform, a technology, a wearable, a solution. It's one of two categories. They may say, here, we have something amazing that we've been working. We're just about ready to launch. Could you take a look at it and tell us how we could be more patient-centered? Or perhaps the group already launched and it wasn't as exciting as they hoped and the uptake was poor or the product or innovation failed. My answer is always generally the same and boils down to this. You need to ideate, design, develop, and launch with empathy. And when I say that to people who aren't generally involved in patient care, the reactions are generally the same. Classic deer in headlights and a variety of different types of confusion. And they ask me, what is this empathy thing? Do you want us to make our platform cute, warm and fuzzy, fluffy? I could stand here until next Tuesday and give you examples to try to convince you of the losses patients face and the emotional distress and the earth-shattering result of a diagnosis. But I have something better. Better than the Twitter handles I could recommend, the thought leaders, the books, the references. This year I had the opportunity to see Dr. Adrienne Boise speak. And in her keynote, she presented a video which resonated with me so profoundly, it took some time to gather my thoughts. It's about empathy and the human connection in patient care. I saw this presented again in Boston at Connected Health. And I said to myself, I need to bring this to New York, to MedStarter. They need to see this. So I ask you for a few minutes of your undivided attention. Be present, take in this video so we can level the playing field, and then I'm going to drive home some points that will make much better sense. if you could walk in the shoes of your end users, the end user of your innovation, whether it's a patient, a care partner, or clinician, would you ideate, design, develop, and launch differently? I guarantee the answer would be yes. So how are you going to get there? How can you design, develop, launch with empathy and create something truly human-centered? You need to immerse yourself in patient and care partner needs, values, and preferences. And I want to point out, I'm saying patients and care partners. There's a whole team of people, spouses, loved ones, family, friends, parents, children, who support patients who are not included in the innovations that we're offering. They are the boots on the ground when there isn't a doctor, nurse, or hospital in sight. Don't forget about them. Don't build innovations and solutions based on your assumptions. Ask. And by ask, I mean talk to patients. Talk to at least 10 to 20 to get an idea of what it's like living with the diagnosis that you're proposing a solution for. Establish a partnership early. Don't design and develop, and right before you launch, talk to one person. It's more effective and efficient from both people's perspectives if you do create a relationship early, establish it, continue it throughout, and obtain feedback at multiple points, even at post-launch. There's no doubt in the current landscape that it's being recognized that patient, and I'm going to go out on a limb, care partner insights are valuable and essential for us to consider to move the needle in healthcare. We need to recognize patients and care partners as true stakeholders of the ecosystem, not just as an end user, not just as an end product, which means we need to compensate them. Compensate them for their time and their expertise. They are the experts of living with their disease and diagnosis on the day-to-day basis. There's no textbook, there's no program, there's nothing on the internet that's going to give you the breadth and authenticity that the patients will. Medicine is based on do no harm and preserving the sanctity of the doctor-patient relationship. As we move out of the traditional four walls of an exam room or a hospital, how can we design privacy, confidentiality, and security in a human-centered way so no patient will ever have to sacrifice their privacy to obtain the care that they need? Think in the context of people who might have a sensitive diagnosis where there's stigma, where digital tools, mobile tools, telemedicine could have a profound impact. There isn't a single person here that would doubt that we would want information to always flow seamlessly, with integrity, and actionably. But I challenge you to design interoperability with empathy. Information shouldn't just flow from a patient, it needs to flow to the patient. Patients need access to their information, especially if we want them to be proactive, empowered members in their care. If you look at it with empathy, it's bigger than connecting data. It's about connecting people and lives. I'm always fascinated by the fact of how well billing information flows. Think about your last encounter with healthcare. Anywhere you go for your procedure, you go for your checkup, blood work, dental exam, that bill comes. Guaranteed. It tells you exactly what you're supposed to pay, where you should send it, and by when. Wouldn't it be great if it was human-centered and the patient got their report and an understanding of what that result means, and then got the bill? It's not enough to focus on patients and their care partners. We need to take care of our doctors and nurses. The rates of physician suicide, the rates of physician burnout are a public health crisis. Nurses are working ridiculous shifts, trying to juggle technology, fulfill administrative burden, while trying to provide care to patients who really need it. I ask you to introduce efficiency, enhance the workflow, and give them back the gift of time. So they're not going home at the end of the day and spending 2 or more hours a night after clinical rotations, after clinical hours, fulfilling electronic health record responsibilities. It's important for me to point out that patient centricity is not an end product. It's the heart of the beginning. It starts with me, it starts with you, it starts with every innovator in this room, whether you have a team of 1, of 5, of 10, of 10,000. If you live and breathe and believe patients should be first, that you agree that their values, needs, and preferences are a priority, and your team lives and breathes that, it will be self-evident. If you're the only one living and breathing it, it's going to be challenging. So you need to get your organization on board, because what patient centricity is a cultural transformation. There's something beautiful about perhaps leaving the office at dusk on a clear day, looking up and seeing the first stars in the night. As children, we were encouraged to reach for the stars. They're timeless, they're untouchable, and they're brilliant. But they wouldn't be possible without the darkness. Healthcare is in a state of darkness, but it's the perfect canvas, an endless canvas that has room for great and small. So I ask you today, design, develop, launch with empathy. Maintain empathy within and throughout, and we can create something magnificent at the end. Thank you.
Thank you, Grace. It was a great talk.